Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm joined with a familiar face. You probably recognize him from HeyRenee, Heal, and the Nick's Nose podcast, the co-founder and CEO of HeyRenee, Nick Desai. Nick, how's it going?
Hey Jared, how are you? Pleasure to be on your program. As always, you do such great work in informing the people about what's coming in health tech.
Yeah, it's always a pleasure speaking with you. It's nice when we're able to get you on this show too, along with your own show. And today we have kind of some special announcements that you just announced. So this is on your latest round. So what I'd like to do in kind of a quick format is give you the opportunity to update our audience on the raise, who participated, who led the round, and then also some other topics today as well. So let's kick things off. First, maybe if you give people a quick blurb if they are unfamiliar with HeyRenee, exactly what HeyRenee does, and then we'll talk more about the raise.
Yeah, so HeyRenee is a new startup created by myself and my wife, Dr. Renee Dua. She's the Renee of HeyRenee. That is a whole-person digital care coordination platform. We bring together all the complex interconnected aspects of your healthcare, your doctor, your therapist, your prescriptions, your appointments, your labs, everything into one place, and give older, polychronic, and underserved Americans a delightful, intuitive interface to manage all their healthcare in one place so they spend more time being well and less time trying to get well.
Yeah, and I remember talking with you in the very early days, right? Probably months even before like the announcements of launching and the initial raise. So I'm super excited to kind of see all the progress that's been made, which anyone that knows you and Dr. Dua knows that's just comes with the territory, right? It's what you're used to.
Yep.
So congrats on the latest raise. You raised $4.4 million. And Can you tell us a little bit about who led the round and then who else participated?
Yeah, so it's a $4.4 million seed two. It's a really great story. We created a deck and a model and everything in mid to late December with the idea that I would talk to a couple of VCs in December, get their feedback, fine-tune materials, and then raise a round in January. Well, as it happens, we were able to get the round. We talked to a VC and Quiet Capital stepped up, offered us phenomenal terms. They're a wonderful partner. Morgan Livermore and Quiet Capital stepped up, and in 5 working days, we went from first conversation on this round to funded closed round. So they led the round. Fika Ventures, Tau Ventures, and Mucker Capital participated. City Light Ventures also came in with a small amount. So we're thrilled to have all of those VCs involved. They're great value add. Some of them we know. A couple that are new to the company, but it went very easily and well, and again, really high quality investors. So we're very, very happy.
Now that you've been able to close the round, what is really the focus of the use of proceeds that you'll be looking at?
The focus of the use of proceeds is really 3 areas. Number 1 is building out the team. And if you're listening to this and if you want to come to a mission-driven health tech company that's built by proven founders, then we are looking for you. Director of Engineering, Director of Growth, operations people. We're looking for really smart, motivated, hardworking people who really want to change healthcare in America. Number 2 is to fulfill market demand. We have a lot of market demand from prospective customers to ramp up, and we want to be able to serve that demand. And this capital will help us do that, both in terms of resources, product, et cetera. And then the third area is continued innovation and R&D, right? We believe that health equity comes through innovation, and we want to continue to innovate at the forefront of creating solutions that are in the best solutions. The best innovations are not the ones that people work hard to learn how to use. And that's where most of health tech is right now. I have to learn how to use it to get value from it. The best solutions are the ones that people enjoy. So it took me 1 second to understand, or it takes anyone who has an iPhone 1 second to understand how to use FaceTime. It's like making a phone call, except someone will show up on video, right? People figure out how to use their remote controls on their TV, but it doesn't take the people figure out how to use their refrigerators. You kind of plug it in, open the door, things are cold, and you hit the button for ice, right? That is what we want to. Our focus on innovation is to make services real people can use with ease of use, with increased intelligence, with whole person, horizontal integration, and those are the three areas we'll spend our funding on. Yeah,
definitely. If anyone's interested in joining HeyRenee, follow Nick on all social channels. We also reshare a lot of these roles from time to time, and you're really great, Nick, about posting those opportunities for everyone to see on LinkedIn. To get in front of them.
Thank you. Well, we want the best people, and we're always looking. So thank you.
Absolutely. Yeah. So if anyone's interested, reach out to Nick. Go on their website. Look on LinkedIn. You'll see the opportunities. Nick, I'd like to shift focus real quick to the results of a recent pilot you and I were talking about a little before we started recording. Can you share some of the details about this recent pilot and the results that you have?
Yeah, absolutely. So we've been doing a pilot on just under 100 patients in their 70s, typically with 3+ chronic conditions, typically taking 8 daily medications, or supposed to be taking over 8 daily medications, obesity, diabetes, hypertension, these types of patients here in Southern California. And the early results have been very, very promising. 94% adherence to taking medications and measuring vital signs, 0 acute episodes during the period of the pilot, which is now almost 5,000 person days. Improving CMS stars on stars rating 21 from 3 to 5 in a 30-day period, and a net promoter score of plus 98 in terms of patient satisfaction with HeyRenee. Now, obviously, there's a lot more to do, and it's early data, but we're very excited about those results.
Yeah, congratulations. That's great. That's a huge win for the team, and you'll continue to build off of that. And now, with those results plus the capital that you just raised, you'll really be able to continue to ramp things forward.
Yep.
Can we talk a little bit about also you heard back that you got into the MassChallenge PandemicX program?
Yep.
Can you first off explain that program for anyone that's not familiar with it, and then kind of talk about your now involvement?
So MassChallenge MassChallenge is an organization from Harvard, MIT, Boston University, some of the other academic and healthcare institutions in the Boston area. They do a contest. They had 331 applications. 15 companies were selected by the United States Department of Health and Human Services to be a charter partner in their PandemicX program, which is a health equity through innovation program, which we're ideal for. We will be doing a pilot with HHS, Medicare, and the Office of the National Director of Health Information. We don't know exactly what that will entail. That's what we're going to figure out this month. But it's exactly where we want to play, at large scale with the right kinds of influential partners, the validation that comes with it, and the opportunity to really go straight to the patients who need our service most.
That'll be exciting to see how that goes for you, and congratulations to you and the team for getting in there. Huge win. I'm from the Boston area, so very familiar with the MassChallenge program and all the good that it's been able to do for the healthcare space. Yep. and beyond. Well, Nick, again, thanks so much for coming on this short and sweet episode to kind of update people on the latest raise, and we've been doing more of these. I hope we can continue doing them, and wish you all the best of luck.
Thank you, Jared. Thanks for having me on, and hoping all of America continues to stay safe and hopefully get past this incredible COVID surge. Thank you, everyone.